Welcome to today's video about symptoms of cardiomyopathy. Have you ever woken up gasping for air, feeling like you're drowning? Or noticed that climbing stairs leaves you breathless in ways it never did before? What if these aren't just signs of aging, but urgent warnings from your heart? Today, we're uncovering 9 critical breathing symptoms that could indicate cardiomyopathy, a serious heart muscle disease affecting thousands worldwide. Most people dismiss these signs when their heart is actually crying out for help. Stay with me, because recognizing even one symptom could save your life. Before we explore these life-saving symptoms, let's understand cardiomyopathy. Cardiomyopathy is a disease where your heart muscle becomes weakened, thickened, or stiffened, making it difficult for your heart to pump blood efficiently. According to the National Heart, Lung, and Blood Institute, this condition can lead to heart failure if untreated. What makes cardiomyopathy dangerous is how it manifests through subtle breathing changes that people attribute to other causes. Your breathing and heart function are intimately connected, and when your heart struggles, your respiratory system immediately feels the impact. The 9 symptoms we're discussing are backed by peer-reviewed research from the Mayo Clinic, American Heart Association, and Johns Hopkins Medicine. Each breathing pattern tells a unique story about your cardiovascular system. Pay attention, because early recognition can make the difference between timely intervention and serious complications. All right, let's go through the major symptoms of cardiomyopathy, starting with number 1, shortness of breath during activity. The first warning sign is experiencing shortness of breath or feeling breathless during normal physical activities. You might think this is just being out of shape, but let me explain why it's far more significant when cardiomyopathy is involved. When your heart muscle becomes weak or stiff, your cardiovascular system loses its ability to pump blood effectively throughout your body. According to research from the Mayo Clinic and American Heart Association, when your heart can't deliver oxygen-rich blood efficiently to your muscles and organs, your lungs must work significantly harder to compensate for this deficit. What happens is your body desperately tries to extract more oxygen from each breath, placing extraordinary demands on your respiratory muscles. This is why even mild exertion, like walking to your mailbox, carrying groceries, or doing light household chores, suddenly leaves you winded and gasping for air. The Mayo Clinic specifically identifies this as one of the key warning signs of cardiomyopathy, and it's often the first symptom that prompts people to seek medical attention. The crucial point here is that this breathlessness is disproportionate to the activity level you're performing. If you find yourself becoming breathless with activities that previously caused no difficulty, your heart muscle may be sending an urgent message that shouldn't be ignored. Next, symptom 2, shortness of breath when lying down. The second breathing symptom is even more concerning because it occurs when you're doing absolutely nothing physical. This is shortness of breath that happens at rest, or specifically when lying down, a condition medical professionals call orthopnea. Let me explain what's happening inside your body. According to research published in the National Center for Biotechnology Information, orthopnea occurs when fluid redistributes into the central circulation as you lie flat. When you lie down, gravity no longer helps your heart pump blood efficiently through your circulatory system. In a healthy heart, this isn't problematic because the muscle is strong enough to handle these fluid shifts. However, when cardiomyopathy has weakened or stiffened your heart muscle, lying flat causes fluid to back up into your lungs because your heart simply cannot manage the redistribution of blood volume. The Mayo Clinic explains that this fluid accumulation in lung tissue makes breathing increasingly difficult and uncomfortable. You might notice that you feel perfectly fine sitting upright, but the moment you recline or lie flat, breathing becomes labored and distressing. This happens because when fluid accumulates in your lungs, it reduces the space available for air exchange, literally causing pulmonary congestion. Many people with this symptom instinctively prop themselves up with multiple pillows without understanding why. This isn't about comfort. It's your body's automatic response to serious cardiac dysfunction. If breathing is easier sitting up than lying down, This demands immediate medical evaluation. Next, symptom 3, waking up gasping for air. Now we come to the most frightening symptom, waking up suddenly at night gasping for air, which doctors call paroxysmal nocturnal dyspnea, or PND. Imagine you've been sleeping peacefully when suddenly you jolt awake, unable to breathe, your heart pounding, struggling to catch your breath. This isn't a nightmare, it's a critical warning that your heart is failing to manage fluid properly. According to research in the Journal of Cardiac Failure and Clinical Studies on Heart Failure, PND represents extreme fluid overload in the pulmonary system. Here's what happens during these episodes. When you've been lying flat for hours during sleep, fluid progressively accumulates in your lung tissue due to your weakened heart's inability to pump efficiently. This accumulation reaches a critical threshold that suddenly triggers your body's alarm systems, jolting you awake with an overwhelming sensation of suffocation. The National Center for Biotechnology Information explains that fluid buildup prevents adequate oxygenated blood flow, and your brain responds by forcing you into consciousness and an upright position. While PND isn't exclusively caused by cardiomyopathy, it represents one of the most serious breathing disturbances linked to cardiac muscle disease. People experiencing PND often describe feeling like they're drowning, and relief comes only by sitting upright or standing for several minutes. If you're experiencing these nighttime breathing emergencies, your heart is desperately signaling immediate need for medical intervention. Next, symptom 4, rapid shallow breathing. The fourth symptom involves a noticeable change in your breathing rhythm, rapid shallow breathing or labored breathing that occurs even without major physical exertion. This subtle yet significant change in your respiratory pattern reveals deep dysfunction in the heart-lung connection. When your heart becomes inefficient due to cardiomyopathy, your cardiovascular system struggles to deliver adequate oxygenated blood to your body's tissues and organs. According to research published in medical journals examining dyspnea in heart failure patients, this cardiac inefficiency triggers compensatory mechanisms in your respiratory system. Your body automatically increases your breathing rate, attempting to capture more oxygen. But because your heart can't effectively circulate that oxygen, you end up taking rapid, shallow breaths that never quite satisfy your oxygen needs. This creates a frustrating cycle where you feel like you're breathing constantly but never catching your breath properly. You might notice yourself breathing faster while sitting quietly, watching television, or having a conversation, activities that should require minimal respiratory effort. The breathing feels like hard work, as if you're constantly climbing an invisible hill. Medical research explains that this occurs because your lungs may receive less perfusion when your heart muscle is weakened, and fluid accumulation in lung tissue forces your respiratory muscles to work overtime. Additionally, the stiffness that develops in lung tissue due to chronic fluid backup makes it harder for your lungs to expand fully, resulting in these rapid, shallow breathing patterns. If your breathing has become noticeably faster or more labored during rest or minimal activity, this represents a significant change warranting cardiac evaluation. Next, symptom 5, difficulty taking deep breaths. The fifth breathing symptom is particularly frustrating because it robs you of something we usually take for granted, the ability to take a deep, satisfying breath. Many people with cardiomyopathy describe feeling like they cannot get enough air, no matter how hard they try to breathe deeply. This sensation of air hunger is both physically uncomfortable and psychologically distressing. Let me explain the mechanism behind this symptom. In various forms of cardiomyopathy, particularly those causing stiffness or dysfunction in the heart chambers, the lungs themselves can become congested or develop tissue stiffness. According to the National Center for Biotechnology Information's overview of cardiomyopathy, this shortness of breath arises from elevated pressures within the cardiovascular system and poor filling of the heart's ventricles. When your heart's left ventricle doesn't fill properly or empties inefficiently, pressure builds up backward into the pulmonary circulation, the network of blood vessels in your lungs. This elevated pressure causes fluid to leak into lung tissue, making the lungs themselves stiffer and less compliant. Think of trying to inflate a balloon that's already partially filled with water. It requires much more effort and never expands to its full capacity. That's essentially what happens to your lungs when cardiomyopathy affects pulmonary circulation. You might feel compelled to take frequent deep breaths, yawn repeatedly, or sigh often in an unconscious attempt to expand your lungs fully. However, no matter how deeply you try to breathe, you can't achieve that satisfying feeling of completely full lungs. This persistent sensation of incomplete breathing is exhausting and anxiety-producing, creating a cycle where anxiety about breathing makes the difficulty feel even worse. Next, symptom 6, coughing when lying down. The sixth symptom is a breathing pattern change that specifically occurs at night, developing a cough when lying down, especially during sleeping hours. You might wonder how a cough relates to heart disease, but this connection is more direct than most realize. According to research published in PMC journals on cardiac cough and clinical guidelines from the Mayo Clinic, this nocturnal cough results from fluid backing up into lung tissues when you assume a horizontal position. When you lie flat, gravity no longer assists your circulation, and if your heart muscle is weakened by cardiomyopathy, it cannot adequately pump blood returning from your lungs. This causes fluid to accumulate in the small air sacs and tissues of your lungs, triggering your cough reflex. Although this symptom appears in the broader category of heart failure symptoms, medical literature specifically flags it as a breathing pattern sign in cardiomyopathy because it interrupts your normal restful sleep and breathing rhythm. The cough is often dry or may produce small amounts of frothy or blood-tinged sputum in severe cases. What makes the symptom particularly significant is its timing and position dependence. You might notice that you cough very little during the day when upright, but within minutes of lying down at night, the coughing begins and may persist until you sit up or prop yourself on pillows. Some people describe this as feeling like they need to clear their throat constantly when horizontal, while others experience violent coughing fits that completely disrupt their sleep. According to Cleveland Clinic research, this isn't a respiratory infection or allergy. It's your lungs literally filling with fluid due to your heart's inability to manage circulation effectively. Next, symptom 7, breathlessness after meals. The seventh symptom might surprise you because it connects breathing difficulty to something as routine as eating, experiencing breathlessness after meals, particularly heavy meals. This seemingly odd connection actually reveals important information about how your weakened heart responds to increased circulatory demands. Let me explain what happens physiologically when you eat. According to medical research on heart failure and digestion, after you consume a substantial meal, your digestive system requires a significant increase in blood flow to process food, absorb nutrients, and manage metabolic processes. In a healthy cardiovascular system, the heart easily increases its output to meet these demands without any noticeable symptoms. However, when cardiomyopathy has compromised your heart muscle's pumping capacity, this increased demand becomes problematic. Your already struggling heart cannot adequately increase blood flow to both your digestive system and your lungs simultaneously. Clinical sources mention the period after a large meal as a time when breathlessness commonly appears in people with cardiomyopathy. The competition for blood flow between your gut and your lungs leaves your respiratory system shortchanged, creating that uncomfortable breathless sensation. You might notice that you need to loosen your clothing, stop talking, or even stand up to breathe more comfortably after eating. Some people describe feeling like they need to choose between breathing and digesting, an uncomfortable dilemma that significantly impacts quality of life. This symptom often leads people to eat smaller meals more frequently or avoid certain foods altogether, not because of digestive issues, but because of the breathing difficulty that follows eating. If post-meal breathlessness has become a regular occurrence, it represents a significant indicator that your heart is struggling with variable demands. Next, Symptom 8. Breathlessness with minimal exertion. The 8th breathing symptom focuses on physical activity, but with emphasis on minimal exertion, experiencing breathlessness with minor activities like climbing stairs. You might think we already covered breathlessness with activity, but this symptom deserves specific attention because of how dramatically disproportionate the breathlessness is to the exertion level. According to the American Heart Association's symptom guidelines for cardiomyopathy, even extraordinarily small amounts of physical activity can trigger significant breathing difficulty when your heart has reduced pumping capacity or stiffened walls. Think about activities that healthy individuals barely register as exercise: walking up a single flight of stairs, carrying a laundry basket from one room to another, or bending down to tie your shoes. These minimal exertion activities require your heart to increase its output slightly to supply working muscles with oxygen. When cardiomyopathy has compromised your heart muscle, it simply cannot increase output sufficiently to meet even these modest demands. The result is that your lungs become affected immediately, and you experience breathlessness completely out of proportion to what you're doing. People often describe this as getting old or being out of shape, but the reality is far more serious. A healthy heart, even in an elderly person or someone who's sedentary, should handle stair climbing without significant breathlessness. If you find yourself needing to pause multiple times while climbing a single flight of stairs, gripping the handrail not for balance, but to rest and catch your breath, your heart muscle is demonstrating profound dysfunction. This symptom represents a hallmark sign in cardiomyopathy precisely because it indicates that your cardiac reserve, your heart's ability to increase output when needed, has become critically limited.
Next, symptom 9, needing multiple pillows to breathe. The 9th and final breathing symptom brings us full circle to body position, finding that your breathing becomes markedly worse when lying flat, necessitating the use of multiple pillows to prop yourself up for comfortable breathing. This symptom, while similar to orthopnea discussed earlier, focuses specifically on the compensatory behavior people develop to manage their breathing difficulty. Medical understanding of cardiomyopathy and heart failure, as documented in clinical research, reveals that this subtle change in sleeping posture represents a significant adaptation to fluid overload and heart muscle dysfunction. When you lie completely flat, fluid naturally shifts toward your lungs due to the distribution of blood volume when horizontal. Your weakened heart muscle cannot adequately pump this fluid through your system, leading to progressive accumulation in lung tissue. Over time, people with this symptom find themselves unconsciously adding pillows to their bed setup, gradually elevating their upper body to reduce this fluid shift. Some people end up sleeping in recliners or propped almost to a sitting position because anything closer to horizontal makes breathing unbearable. According to medical literature on heart failure symptoms, while specific pillow counts aren't always detailed, the underlying mechanism of positional breathing difficulty is extensively described in cardiomyopathy sources. This isn't about comfort, preference, or habit. It's a physiological necessity driven by your heart's inability to manage circulatory fluid dynamics. What makes the symptom particularly insidious is how gradually it develops. You might add one pillow, then a few months later another, slowly adapting to your worsening cardiac function without recognizing it as a medical emergency. If you've noticed you can no longer sleep flat or have progressively added elevation to your sleeping position, your heart is telling you it needs immediate medical attention. We've explored 9 critical breathing symptoms that could indicate cardiomyopathy, and I hope this information has shown how connected your breathing patterns are to your heart health. Cardiomyopathy is serious, but when caught early, many treatment options exist that can significantly improve your quality of life and prevent progression to heart failure. If you recognized any of these breathing symptoms, especially multiple ones, please don't dismiss them. Schedule an appointment with a cardiologist immediately for comprehensive cardiac evaluation. Your breathing is telling you a story about your heart's health, and listening to these signals could save your life. Early detection and intervention make all the difference. If you found this information valuable, please type "valuable" in the comments below. Your feedback motivates our team to create more health content like this. Take a moment to like this video, share it with family and friends, and subscribe to our channel. Thank you for investing in your health education. Stay healthy, stay informed, and take care of your heart.